The pandemic has taken its toll on people, and Recovia is a place to help with chronic pain to behavior issues. So to get you back on track in your life and to help us out is Erica and Dr. Devin here with us. Good morning, you two.
Good morning.
So I want to make sure, Recovia. Did I say it right? There you go. How are you two doing?
Good. Doing well.
So, all right, so Erica, let's talk a little bit first about what Recovia is all about.
Yeah, so Recovia is a chronic pain and substance use clinic that we specialize in general mental health. Substance use can be prescribed, unprescribed, addictions, so negative life events, PTSD, and it's an integrated outpatient program that is a combination of physical therapy, medical, and behavioral health.
Yeah, and doctor, that's very important for people because sometimes staying in a facility could it'd be good for some people, but some people like to be able to maybe go home where it's comfortable, and you guys train them to actually be able to go ahead and do that, don't you?
Yeah, so the inpatient treatment is very important in itself, but having an outpatient setting where patients can go home and utilize the skills that we're working on, when they're in the program each and every day is great. In addition to that, they're confronting, the stressors in their lives every single day in the real time, so they can learn something with us at Recovia and then go home and use those skills each and every evening.
Yeah, and again, right now we're seeing more and more people needing something like this. And again, maybe, and I'm not saying not have the time, but maybe not have the ability to stay in a recovery place. And that's where you guys come into, right?
Yes. Yes, it's outpatient based. So our program, there's a commitment to our program, but most of our patients, as I think that they would tell you in the community, that through our program, being able to practice those coping mechanisms that they learn in program with family and work and friends has really increased those relationships and been able to help them function at a higher level.
Yeah, and also, doctor, I like that you guys are actually trying to break the stigma about mental health and people taking care of themselves. Because chronic pain, and someone's like, well, I don't want to go see someone about that because then it makes me feel like I mentally have problems, when really it just might be them needing to talk with somebody, needing them to make adjustment for you to guide them.
Yeah, we see pain as both physical and emotional. So it's a bi-directional process, and so patients that are experiencing physical pain also experience emotional pain, and the same thing the other way around. And so we always approach pain from that whole person model. So that way patients are really managing the pain from all directions instead of just, seeing a psychologist outpatient or a physical therapist outpatient. We're bringing it all together.
Yeah. What are the ages that you are starting to see people at the center?
18 and up.
Mm-hmm.
18 and up,
Yes.
And that's very important right now, especially as we're seeing college students, we're seeing family, people working. And I think probably the biggest thing you're seeing right now is people trying to maneuver getting back to work, or actually maybe who've lost their jobs trying to reconnect with themselves. Is that some things you see?
Absolutely. Every single day we see people coming in that are struggling to get back on their feet, are wanting to make change in their lives, are looking to maybe press a reset button and get back on their feet.
Yeah. Erica, you said about, of course, a commitment.
Yes.
And it's more of where you're committed to each one of your patients, each one of your clients
Yes.
that come in. And that's important, but you're asking them also to make a commitment too, aren't you?
Yeah, absolutely. We've been named and handpicked as a center of excellence from many Medicaid plans in the community, from payers and their members. So we're very excited about that. And that goes along with the excellent coordination of care that our providers provide in the program, and also too that the patients have committed to us to give them what they need going through program. So yeah, with all of them coming through program, typically the programs run at 3 days a week for about 4 hours a day for a 6 to 8 week program. And through that, our providers and our team of providers coordinate care for their treatment plans.
Yeah, that's great. And doctor, again, we say that you are knowing that everybody's individual. So even though you're coming into a group maybe, or talking with people, you always say, we sit down with you first and go through things, right?
The treatment plan is individualized and tailored to the patient. We also have group therapy though, and I think some of the beauty of group therapy is that each person is coming in with their own history, and they can come together and really benefit from hearing each other's stories and working together.
Yeah, I'm going to ask you both some just quick tips if someone's watching right now, what they need to do, prepare themselves to come see you guys, because that's something that you always like people to do. So, doctor, you have one quick tip just to prepare people to come see you?
I guess a quick tip would be an open mind to, taking in everything that we offer, and again, being open to utilizing the tools that we're here to teach.
Yeah, I like that. Erin?
Yeah, and I think just taking the first step, give us a chance, and we'll help you get your life back, and just give us a shot to come in to one of our clinics across the valley. We have 4 in-person clinics right now. We also have a virtual care clinic, so we do reach those populations that can't necessarily come in person, but are also in rural communities. So, you know, check us out on our website and just give us a shot to come in and have a 1-hour meeting with each of our providers to really understand what our program is all about.
That's great. And the website is, Erica?
www.recovia.com.
There you go. Perfect. Thank you, ladies, for coming in. Thank you, Doctor and Erica. So,
Thank you.
all right, there you go. You know, again, a great way to, of course, get your life back on track is right there, and information's on AZTV.com. So there you go. All right. Hey, we got more of the Arizona Daily Mix coming up after this.